My name is John Glomset. I'm an orthopedic surgeon at OSOI SSM. I was born and raised in Oklahoma City. I went to the University of Oklahoma for undergraduate as well as for medical school. And after medical school, I moved to New Orleans where I did orthopedic residency at the Ochsner Clinic. After residency, I transitioned into active duty military service, so I was part of the United States Army for 5 years. And then afterwards, I went to fellowship at the Steadman Hawkins Clinic of the Carolinas where I did a sports medicine and shoulder reconstruction fellowship. I moved back to Oklahoma City about 2.5 years ago, and I've been in private practice here ever since. I've been out of residency for 8 years now. During my time in the military, I was stationed at a small town in Oklahoma, and I practiced medicine in that small town for 5 years. Living in a small town has its unique challenges in terms of building a practice. You have some natural competition from people who have probably been in that community for a while. It may vary. There may be some small towns that don't have a lot of competition. And so some of the unique things are kind of establishing yourself as part of that community and somebody that they can trust. Because they, in a small town, a lot of people know, everyone kind of knows each other. To establish yourself in a small town, you really have to gain people's trust. And so obviously that starts with doing a good job and having people trust you because you're honest. And then you have to also be involved in the community. So you need to go to community outreach events. You need to involve yourself in, especially in orthopedics, you need to involve yourself in high school sports. Make yourself available after hours, and really start feeling like you're part of the community and start acting like you're part of the community. So local politics are really important. It's really important to understand kind of what you're up against and who you could be fighting against in terms of trying to get something done, and what kind of external forces are going to shape your practice, because you can have some people who want to help you, and there are also some people who are going to really want to tear you down. And if you don't have an understanding of that, you can be kind of running against a wall and not really understand why. One of the examples of politics in a small town is understanding the referral patterns from the primary care physicians as well as other orthopedic surgeons. There are a lot of under the table agreements or just traditional referral patterns that if you don't understand, you may not be able to tap into those referrals, and you may not understand why all the patients with X get referred to Oklahoma City when you were in that town providing that service. And if you don't understand that, you'll never capture that volume. Building a practice in a small town is really community-based. It's all trust-based. Not to say that you could do a bad job and build a practice, but in some ways you could. If you are really honest with people and you're involved with them and they know who you are, they're much more likely to come to you than drive to the big city or drive somewhere else. Word of mouth or reputation is important if you're in a small town or a big city, but probably much more so in a small town because of the size of the community, meaning that if you have a bad experience with a patient or if you had a bad outcome, you really need to get ahead of that, because in a small community, very quickly everyone will know about that. Much different in a big town where there's multiple orthopedic surgeons, there's much more people. And so managing complications, managing expectations, managing individual patients based on difficult personalities is really important in a small town. In a small town, marketing is probably not as important as it is in a big town or in a big city, just because there probably aren't as many choices. And so word of mouth, like we talked about, word of mouth reputation are much more important than traditional marketing that you're going to see in a big city with commercials or advertising or social media, or et cetera. One of the things I really enjoyed about practicing in a small town is that relationship and knowing people and knowing the grandma who I've replaced their knee and the grandson who I've done their ACL, and seeing them at a restaurant and having that regular interaction. Obviously there's some challenges that are associated with that as well, but for the most part I enjoyed that. So when deciding whether you want to start in a small town or in a big city, it's really important to just consider your own personality and your family and where they want to be. Money is not so important as it is deciding where you want to be. The money and the production and the volume, that will come in time. Focus on where you want to be in terms of a location, what kind of activities you like, what's your personality, what's the personality of your family, and integrate that into the location you choose. There are definitely some differences working in a small town if you're a private practice or employed versus if you're a military physician. One of the things about being a military physician is you don't really have to work on referral patterns very much because those patients are naturally referred to you. There is obviously a different sense of community too, because you have your community of the military. You're trying to integrate into the local community, but it's difficult because the military community is usually short-lived. People don't stay at the bases for very long. So there's some challenges in establishing yourself as a military physician in a small town. My situation in the military was much different than the majority of surgeons in the military. I was able to have a practice in the military. I was also able to accrue enough leave that it took leave to moonlight. And during that moonlighting time, I developed a practice in a small town. That's not a usual situation for a military physician. My biggest takeaway from practicing medicine in a small town was make sure to develop the relationships with other physicians, because you are very dependent on other physicians for the referrals in small towns. And if for some reason you have a bad relationship with even a single physician that's busy, your practice is gonna lose out.